Dear students, today we will talk about principles of treatment. There are two ways in which we can treat any infection. First way is to reduce the effects of the disease. What is the meaning of this? To reduce the effects of the disease is to reduce the symptoms. So, what we can do? We can take medicines to reduce the symptoms. What are different symptoms in any kind of infection? There can be fever, there can be pain, and in an infection related to intestine, there can be loose motions as well. So, to treat these or to reduce these symptoms, we will take medicines to bring down fever or to reduce the pain. Or if it is an digestive system infection, then we can take a medicine to reduce the loose motions as well. But this approach is temporary. As soon as the effect of the medicine wears off, the symptoms will come back. That means again you will experience fever, pain, and loose motions. So we need a permanent treatment which includes killing the cause of the disease. This is the permanent solution in the principles of treatment. To kill the cause of the disease, what is the cause of the disease in case of infectious diseases? It is microorganisms. Disease causing microorganisms are cause of the disease. So, in the second approach, we will kill off the microorganisms. How can we do that? How can we kill off microbes? By using antibiotics. Antibiotics are medicines that are used to kill off the microbes. Here we need to understand very important question before moving forward. Why making antiviral medicines is harder than making antibacterial medicines? Antiviral medicines, antibacterial medicines, these are all antibiotics. It is difficult to make antiviral antibiotics and it is easier to make antibacterial medicines. The answer lies in the biochemical pathways used by viruses and those used by bacteria. We know that viruses are obligate parasites. They do not have biochemical processes of their own. They use biochemical processes of the host cell. So if we try to block the biochemical pathways of a virus, we will actually end up blocking the biochemical pathways of the host cell, which is not going to treat the infection. It is going to kill the host cell. We don't want to kill the host cell. That's why making antiviral medicines is harder as compared to making antibacterial medicines. That means it is easy to make antibacterial medicines. Why? Because bacteria, they have many biochemical processes of their own that are not found in the host organism. So we can easily target them or block those processes which are related only to the bacteria. So that's why it is easier to make antibacterial medicines as compared to antiviral medicines. So in this video, we have talked about the principles of treatment. There are two approaches. One is temporary, in which we reduce the symptoms. We take medicines to reduce the symptoms. And second approach is the permanent approach, where we kill the cause of the disease. That is, we kill the pathogens that are causing the infectious disease by use of medicines known as antibiotics. Thank you.